Okay, so having dealt with an unconscious casualty who is breathing, now let's look at how we would deal with an unconscious casualty who is not breathing. Obviously this is a more serious situation and calls for a manoeuvre or a technique that we know as CPR. CPR stands for cardiopulmonary resuscitation and is a way of artificially moving blood around a person's body to get oxygen to the vital organs, particularly the brain, until professional help arrives. So there are certain things we need to consider if we are faced with a non-breathing casualty. And the first of all, and the most important thing at this stage, is to phone for help. In the past, we've been encouraged to shout and do all sorts of things for help, but now most people do have mobile phones. So if that's the case, take your phone out, call 999 or 112 and tell them the situation. Also, they will stay on the phone for you for as long as you want. So if you have a speakerphone facility on your phone, then just press speakerphone. That leaves you free to carry on with the CPR and they will give you guidance at this point. If you don't have a mobile phone and you have to leave the casualty to make a phone call, then you must do that too. It is absolutely essential that we get the emergency services mobilised before we start CPR because of the time factors that are so critical in this situation. So having made the phone call or got someone else to do it, also you want to consider, is there a defib in the area? A lot of people now have defibs in communities, so you could always send someone to fetch one if you know that there's one in the area. Okay? But to the CPR itself, what we first of all need to do is to start with compressions. There are two ways of approaching this. The UK Resus guidelines still state that it is better to do compressions under breaths. However, if for any reason you are not happy with doing the breaths, you can perform what's known as compression-only CPR. There is no right or wrong approach to this. It is a personal choice that you make and you don't have to justify that choice. You go with whichever you're happiest with. I'm going to look at this point on the traditional way with the breaths. So first of all, we take one of our hands and we place it on the sternum, on the breastbone of the casualty's chest. Obviously they need to be flat on a hard surface to perform good compressions. Heel of your hand on the chest, bring the other hand over the top and interlock the fingers. Your arms want to be straight, and if we can peel the hand back off the chest so that the only point of contact is the heel of the hand, we will get a much better compression. We're going to press down approximately 5 to 6 centimetres on this person's chest, which is around about 2.5 inches. At that depth, there is a distinct possibility that you will break ribs. Please don't worry about this. They can be fixed later. We need to be quite aggressive in this to get that blood moving. So hands on the chest, arms interlocked, and we're going to do 30 compressions. The speed of compressions we're aiming for is between 100 and 120 a minute. So if you say 120 a minute, that's 2 a second, which is something like this. That's the sort of speed we're aiming for, and remember at a depth of 5 to 6 centimetres approximately. We will continue the 30 compressions. After we've completed the 30 compressions, we then do 2 breaths. Again, we need to open the airway, so one hand on the forehead, 2 fingers on the chin, tilt the head back, pinch the nose closed and make a good seal over their mouth and place 2 breaths into the person's mouth. Your eyes should be on the person's chest at this stage so that you can see the rise and fall to indicate that your breaths have gone in. Don't worry if they haven't. 2 breaths is all we need to do, whether they've gone in or not, then back to compressions. Okay? Having back onto compressions, we do another 30 compressions and then another 2 breaths, and we repeat the sequence. When do we stop? Well, obviously if we're exhausted. If it's taking a long time for the ambulance to get to you, you will become exhausted. You know, we're not robots, we're not said and done. The other time for stopping is when the ambulance crew or the paramedics turn up and they tell you to stop because they can then take over. If you have a helper with you, they can obviously assist and you can get a brief respite and work in tandem. And the unlikeliest time to stop, of course, is if the person does start to show signs of life or breathing at this point, then we can stop at that point. But that is very unlikely. It's usually the case that it's the defib that we need to actually make that difference regarding the patient's condition. CPR is a way of just artificially moving the blood around the person's body until that professional help arrives. So again, don't expect them to recover at this point. Okay? So thanks for listening and watching. I hope you found it useful and I'll see you again soon.